Hello, my name is Shweta Parmar and my student ID number is 19635095. My presentation is based on Illawarra Shoalhaven environmental scan. Let me share my PowerPoint. So first of all, environmental scan is the processing of the documentation of organizations' internal and external environmental events. The main purpose of the environmental scan is to determine a clear goal which will help the organizations in the future. Sometimes environmental scanning is expensive that because it requires a specific information which can only be obtained through specific research and therefore this research may cost a lot. In addition, environmental scan is necessary to understand a demographic profile, determine the burden of health and morbidity and mortality. A strategy by Illawarra Shoalhaven local health district who provide health services to 400,000 people within the Illawarra Shoalhaven region. ISLHD consists of metro and regional area, which include the aboriginal population. Also, the aging group of people were included in this approach. There are various social determinants of the health for Illawarra Shoalhaven people to discuss in this environmental scan, which include education and unemployment. This district includes 8 hospitals and more than 55 community health services where they are providing the services. If we are talking about a strategy, then there are two type of strategies. Like one is a strategic direction for Illawarra Shoalhaven local health districts 2017 to 20 and Illawarra Shoalhaven integrated care strategy 2018 to 20. The aim of ISLHD was to provide excellent service delivery and good quality and good partnership to the people. Let's talk about the plan, first plan, which is a strategic direction for Illawarra Shoalhaven local health district 2017 to 18. This plan is about 3 year and main focus on public, upcoming planning and better deal with regulars. It is a solution to increasing number of residents, use of services, local people who have a higher rate of long-term disease and high risk factor. This strategy is based on 4 strategic priorities. The first strategy was to provide an excellent model of care, health program, and health services. The and which they were successful. The ISLHD has a good reputation for delivering high quality healthcare and appropriate health services. The second step is engaging of high performing workforce for the better future in which ISLHD is now considered an employer of choice, such as an aboriginal employee within the region. The third strategy of ISLHD is the innovation, agility, and learning for continuous improvement. This local health district is well respected and known for the research which they organize and for the innovative approach of the healthcare improvement. The final priority of ISLHD is efficient, effective, suitable financial status. Under this plan, they create organization who keep an eye, I'm sorry, under this plan, they create organizers who keep an eye on finance flow. Now, let's see towards integrated care strategy. Uh, you can say it is a collaborative approach of primary health network for southeastern New South Wales and Illawarra Shoalhaven local health district. Uh, this is about thorough care of patients in terms of physical health as well as mental health. Uh, this plan is designed in a way that they can reach a smaller and rural area. Thus, it can say that it focus on more patients' needs rather than the serving typical structure. They are also working on out of patient access, so patients receive their treatment at the right time and at the right place. There are different projects running under this plan, such as suicide prevention plan, care organization for the sufferer from the chronic disease and complex health problem, and improving the health of Aboriginal people and care of the residents. Another plan is New South Wales State Health Plan towards 2021. It provides general framework to all New South Wales local health districts so they can use it as a guideline. It has three direction and four plan. ISLHDs also follow this plan by initiating the plan which is closing the gap of the health inequality for the Aboriginal and Torres Strait Islander people, working on Care Closer to Home program, and implemented Illawarra Shoalhaven integrated care strategy. In addition to this, it follows plan by implementation of Aboriginal employment, promoting research and innovation, and developing infrastructure. At the end, Illawarra Shoalhaven Local Health District is working on the problems and making facility accessible to the patient by implementing various plans.
The Illawarra Shoalhaven Local Health District is currently home to around 420,000 people, although this number is steadily growing due to its prime location just outside of Sydney. The district consists of both metro areas like Wollongong and areas that are classified as interregional like the Shoalhaven local government area. The population itself is diverse, with 18% of people having been born overseas. They also have a higher than average Aboriginal population, with 3.4% of the residents identifying as Aboriginal or Torres Strait Islander. A growing population in Australia is synonymous with an ageing population. And while the population spread is fairly even currently, as we can see in the graph, it is projected that in the next decade, 25% of the Illawarra Shoalhaven population will be over 65 years old. Even now, the number of people over the age of 75 is 1.5% higher than the state average. There are many reasons for this, but one is that the area is a very attractive place for retirement, with its out of the city beachy feel, but still well within reach of the Sydney area. The health of the population is dependent upon their relevant social determinants of health. These are the social, political, environmental, and economic conditions in which people live and work. It is important in the development of any health policy to assess these determinants to best cater for the population. One such determinant is that of education, because the level of education attained can be directly linked to the earning potential and the likelihood of engaging in risk behaviours. That being said, Illawarra Shoalhaven residents go against the trend in terms of education versus earning potential. We can see that in the area, there are about 40% of people holding their higher school certificate or equivalent, which is 10% less than that of the state average. This has not limited their income though, with the median salary of the area being on par with the state and unemployment also meeting the state average. There are a number of risk behaviours that the community within this health district are more likely to engage in, including but not limited to smoking, drinking, poor food choices, and sedentary lifestyles, which could be a direct result of their lower education status. These risk behaviours all compound and lead to an increased demand for health services, as people are more likely to suffer from diseases such as diabetes and cardiovascular disease. These diseases place an increasing burden on the community through time off work, the need for health services, and the need for more personal support. The general measure for this burden of disease is a disability adjusted life year, or for short, a DALY. On a worldwide scale, the causes of the highest number of DALYs are cancer, cardiovascular disease, and injuries. But within New South Wales, instead of injuries, mental illness accounts for the number 3 spot. This means that when health services are designed and planned for, there must be a special focus on these diseases and how we can not only manage them, but also try and prevent them. As mentioned before though, the growing and aging population may change these statistics, with an emergence of diseases more common in the elderly expected to increase. We can see this as we look at illnesses like dementia, which have seen a significant increase in hospitalizations over the past 5 years. Health services will need to forecast and plan for these evolving needs. Another group of statistics useful in the formulation of an environmental scan are the morbidity and mortality statistics for the area. These have long been used by health professionals as an assessment tool for a population's overarching health status, because this information is easily accessed through census data, death certificates, and hospitalisation records. These base statistics can then be grouped by race, gender, age, and causative disease, giving a more detailed view. For example, we can see that in the Illawarra Shoalhaven Local Health District, the average life expectancy at birth is 82.7 years old for females and is only 80.4 years old for males. If we take CVD as a token disease, the mortality rate is higher in this district than the state average. But through assessing this mortality rate in conjunction with the social determinants of health that affect the area, we can see that 64% of people are overweight in the district and 23% have high cholesterol. Couple this with their lack of physical exercise, poor eating, smoking, and drinking, and there is a clear reason for the high rates of mortality. This is where health services can establish CVD treatment clinics, as well as develop health promotions targeting healthy eating, exercise, and low alcohol and cigarette consumption to try and combat the problem.
Hi, my name is Christy Philomena. I would like to describe about the Illawarra findings and health plans. Let us know about the Illawarra findings. It is Aboriginal population growth, health plans to abort the chronic disease, environmental plans, clinical nurse and midwifery in New South Wales Health Service, development of national meal guidelines. So first, let us know about the Aboriginal population growth. As we know, like Australia consists Aboriginal population, and almost the population growth is very high, and even the chronic disease for the Aboriginal is high. And let us know about the future plans of this. Aboriginal Australians are known to experience chronic disease at much higher rates than other Australians. The study focused on the services and programs available to Aboriginal people following their discharge from hospital and their experiences of those services. So, the wide gap in life expectancy between non-Indigenous Australians and Indigenous people has been widely recognized as a national issue for over a decade, and efforts to address this problem. It is based on a review of guidelines available for management. Illawarra consists of around three main themes: design, operations, and cultural capability. Let us know the environmental plans. The Office of Environment and Heritage, in consultation with EPA, has developed a risk-based decision-making framework for managing stormwater, which is being applied to Lake Illawarra. Outcomes include stormwater load reduction targets and feasibility assessment of options to inform management decisions. So then allocates resources for management according to the level of risk. Ultimately, areas of high environmental value will be identified through recognizing process and new development proposals to avoid, minimize, and mitigate the impact of development on significant environmental assets. Now, let us know about the agriculture. Approximately 20% of region is located within the Sydney drinking water catchment area. Protecting water quality and quantity in the catchment is essential for the health and security communities. So, as we know, the framework is an outcomes-based approach which considers how the waterway functions and communities' objectives for the lake, then allocate resources for management according to the level of risk. Now, coming to clinical nurse and midwifery consultants. A clinical nurse, they play important role in clinical service and consultancy. So the findings identified an experienced workforce with 25% of intent to leave over the next 5 years. Nearly 47% of the participants were working towards master degree. So career planning is defined as the continuous process of thinking about your interests, values, skills, and preferences, exploring the life, work, and learning options available to you, ensuring that your work fits with your personal circumstances, continuously fine-tuning your work and learning plans to help manage the changes in your life. This section combines both survey and focus group results. The study captures CNMs are 95 permanent clinical nurse and midwifery consultants are in Illawarra district. Now let us know about the national meal guidelines. Poor nutrition, reduced levels of physical activity, social engagement, and connectedness can negatively impact physical, mental, and social health. As the number of people entering old age continues to grow, optimizing and support the health and well-being of older. So they also identify priorities areas for illusion in the guidelines, including nutrition recommendations for customers, dietary modification for special needs, menu variety, structure, and meal experience consideration. Future research should examine the uptake and satisfaction of the service providers and health professionals with the national meal guidelines. So the survey contained 33 questions and took approximately 15 minutes, closed multiple choice, etc. So this encouraged menu variety with almost two-thirds of the participants reporting the availability of menu choice, about 59%. So these are the findings and plans of Illawarra. I would like to findings of Illawarra.